Hi, I'm Leah Grout. I'm from Vermont, but I work remotely for Southern California University of Health Sciences, hence the Vermont, California at the bottom of this slide. My favorite physical activities are trail running, skiing, and paddling. I couldn't choose just one, but essentially any way of moving through nature through the seasons. So next slide. In terms of next steps that I've been involved in, I've been working with Dr. Sentel and Esme and others to start synthesizing the global evidence base on culturally and regionally relevant physical activities for health promotion through a scoping review. We've already identified a lot of relevant articles, many by some of you in attendance today, throughout the literature and across different areas of science. Now, especially at a time when some resources have been removed from various websites here in the US, especially if they contain certain words or terms that our current government dislikes, we're hoping to create a database that can serve as a safe place to store and to highlight these materials. We envision a database that can serve as a resource to other researchers or communities, whether to look at a subset of the literature for their own projects or to identify papers that they can cite to support applications for funding opportunities or for other purposes. And so as we work on the scoping review, we're starting to extract a lot of data from these articles, including general information like author, year, title, and source type, whether the studies use qualitative, quantitative, or mixed methods. Also, importantly, the type of physical activities, including whether they are land, water, or snow or ice based, whether they are indoors or outdoors, solo or group, or even if they are seasonal activities. We are also noting the population engaged in the activity, different age groups, special or vulnerable populations, as well as the location. We're noting whether the material uses a social ecological model or an Indigenous health framework. We're keeping track of the types of health and well-being outcomes. There are a lot of different ones, and we're including individual and collectivist perspectives of health. So noting things like social cohesion or connectivity. We are also flagging a number of other things, including materials with a focus on substance use or abuse. There's a large literature there. Also planning for or responding to emergencies or disasters, interventions, measurement tools or questionnaires, and many other things. Hopefully, it will reach a point where if you have a particular interest in a specific activity, population, location, or outcome, you would be able to search the database for those items for your own purposes, or even contribute new materials to the database in various formats. Right now, we are starting with peer-reviewed articles in English, but our hope is to extend our search to other types of materials and other languages in the future and to be as inclusive as possible. We would love to hear any thoughts or ideas that you might have related to the development of the database and how it could be useful to you or some of your other colleagues. So please feel free to reach out to me via the email address on this slide. That's all from me for now.